State lawmakers preparing for next month's legislative session are laying out their ideas to deal with Arkansas's maternal health crisis. Channel 7's Kaylin Clay now with the second of her three-part series on one of our state's most pressing issues. Tonight, she speaks with some key players at the Capitol about their plans.
You know, if you've been following the maternal health issue, you saw that, about 34%, 1 in 3 women in Arkansas are losing coverage after that 6-week period.
It's the policy proposal creating the biggest buzz as lawmakers approach the next legislative session, expanding postpartum medical coverage under Medicaid.
I know all of us want to find real solutions, not headline-grabbing programs that don't actually solve the problem. This budget puts money behind that goal.
Governor Sarah Sanders addressed the Arkansas legislature in November as she proposed $13 million in new Medicaid funding and an additional $100 million in funding set aside for Medicaid sustainability.
Knowing that there is a commitment from the leader of our state is not only encouraging, but also shows that there is just so much broad support for improving maternal health in Arkansas as a whole.
If you've been following Arkansas's maternal health crisis, you probably recognize the name Ashley Bearden Campbell. She's a political consultant and the executive director for the advocacy group Arkansans for Improving Maternal Health. AIM seeks solutions to this crisis, and a central part of their advocacy is expanding postpartum Medicaid.
And we know that statistically that the majority of moms that have these complications are having them later in that 4th trimester. So by expanding Medicaid postpartum services to that full year, we can ensure that we're capturing them during this vulnerable time and giving them access to the resources that they need to not just survive, but to truly thrive.
Campbell once found herself in the same life-threatening position of moms she now advocates for, facing an expecting mother's nightmare in her 3rd trimester.
I went to the emergency room and was told, this is all very normal. You're pregnant, you're a first-time pregnant mom, you're fine. And I'm so thankful every single day that I listened to my intuition and pushed for further testing because it turned out to be pretty severe preeclampsia, which caused me to deliver my daughter via an emergency C-section at 28 weeks. And so that was a really traumatic experience. My daughter and I both almost lost our lives.
But it wasn't just during pregnancy and delivery that Campbell faced a challenge.
While she was in the NICU, I was diagnosed with postpartum depression, anxiety, and PTSD.
Campbell recognizes that she was fortunate to actually get the help she needed. And that's where her advocacy journey begins.
I did not want any other mom to feel the way that I did and have that lack of information.
No mom left behind. That's what AIM aims for. Not only does the group advocate for moms and meet them with resources, but public and policy awareness tops their priority list. And lawmakers are responding, like State Representative Aaron Pilkington, who filed House Bill 1004 that would require Medicaid coverage for postpartum mothers for 1 year after giving birth.
What we're doing here is we're actually having women auto-enroll into our homes, which is an existing Medicaid expansion population. And this was kind of part of the last 2 years as we've gone through this group with the Maternal Health Task Force and looked at things. We saw that some women were getting transferred, some women were qualifying for other programs. And like the governor said, there's a lot of existing programs out here that are not being fully utilized. And so my hope with this is we're a little more tailored to Arkansas and our unique policies, but we're making sure that all women get covered.
Medicaid coverage for all phases of the pregnancy journey is a goal Pilkington aspires to achieve. That's why he's also filed a bill that would allow the Arkansas Medicaid program to make presumptive eligibility determinations for expecting mothers.
We saw that, a lot of women weren't accessing health care early on, which that was a big problem as well because some women are just showing up at the ER when they're delivering, and that is not a great situation to be in.
Pilkington also filed House Bill 1061 that would require Medicaid to cover continuous glucose monitors for women with gestational diabetes, a condition that can lead to life-threatening situations. A legislator cheering him on is from across the aisle.
He and I have actually worked together on a couple of those pieces of legislation, and I'll be co-sponsoring them with him. Representative Pilkington and I get along, and I know people are always shocked to know that, Republicans and Democrats can play together in the legislature, but we can.
While this unlikely duo collaborates, one key question is, How do we attract more physicians to the state to fill the gaps and provide essential care to every corner? Hudson believes the issue of abortion is an obstacle.
Because of the abortion ban and because of the risk associated with practicing medicine, insurance rates have increased for obstetrics because the insurers look at this and say there is higher risk for people to practice in this field because there are laws in place that will make them liable even if they're doing something that's within the standard of care.
Hudson says she intends to bring back legislation that carves out an exemption to the abortion ban for victims of rape and incest, calling it a multifaceted issue with multiple solutions, and hoping it can help put aside agenda norms.
I respect how he approaches being pro-life, and I think he respects the way that I approach being pro-choice, because when we get down to it, we both have similar goals, and we want to make sure that women and babies in the state are healthy. And so that's why we can work together on these issues and find common ground where we can and respect the differences where we can't.
The conversation is reaching to the federal level. Senator John Bozeman has hosted roundtable discussions with Arkansans from all corners, hoping to turn that dialogue into action.
You know, our state is a big state, and the solution in one part of the state might be totally different than the solution in a different part of the state, and that's true throughout the country. So what we try and do is provide resources and then help the state make those kind of decisions. They're the ones that are closest to the problem, with the idea of getting a good result at the end.
Through every handshake and conversation, Bozeman is hopeful. Some
things are so difficult to solve, but this is one that with all of us working together, there's a path forward. We can make a huge dent in this. And again, this is all about saving lives.